This video may contain content that could be triggering for some viewers. Issues concerning mental health, chronic illness, and hidden disabilities, and subjects related to and including trauma may be discussed. This video also includes life advice derived from my own research and experiences. References are included where necessary. If you feel uncomfortable or distressed at any point during this video, please feel free to take a break or stop watching for your own well-being. Your health journey is of utmost importance. Also, please be advised, I am not a medical practitioner of any form. If you are concerned for your health situation, please seek the advice of a trained medical professional. To all of you who have hung around, thank you so much for returning. It's because of you that I'm here, and it's truly appreciated. In the mid-90s, I was admitted to a ward of the local hospital for a month before giving birth to my first child. In my mid-20s, my blood pressure was very high, I had protein in my urine, I was not happy, I was very stubborn, and I had preeclampsia. Wondering what that is? Well, I'm going to share a little bit of my story and tell you how this could possibly affect you. Preeclampsia is serious, and probably you have absolutely no idea how. But before I press on, don't forget to tap that like button, and if you haven't already, hit the subscribe button too, and don't forget the bell so that you know when next I release a video. I was put on many monitors, placed on bed rest, experienced many scans because my baby was what they classified as low birth weight. A bit over 36 weeks, I was induced, and thankfully she was amazing. My stubbornness and lack of knowledge and understanding of the condition did not work in my favor now that I'm in my 50s. I'll tell you why, but later. A few years had passed, and then I had my second child, and again I had hypertension, but I didn't want to be diagnosed as preeclamptic and admitted again. So yet again I was stubborn, I did something dumb, and I am annoyed with myself every time I think about it. I was so afraid of being stuck in the hospital again because it was around Christmas time and I wanted to be with my family. I missed some of my appointments. How stupid was I? That was such a stupid thing to do. When you think about how you were when you were younger, right? Do you sometimes shake your head at the idiotic things you had done? Thankfully, like his big sister, he was fine too. A bit bigger, but just on the cusp. I thought things ended there. Most of the focus was on the child at the time, so other than the postnatal checks, I had no further investigation into the preeclampsia either time. Sometime after, I began presenting with some issues, cholesterol and hypertension, chronic kidney disease. I knew that I had a familial link to the first two, but the third? Where did that come from? No. I didn't have sufficient information on about preeclampsia. I was just told that I needed to be in hospital because there was protein in my urine and my blood pressure was high. I wasn't given all the information that I should have had, but then again, that was quite a long time ago. The research that we have now isn't what we had then, so therefore, I had no idea how impactful the condition was going to be on my health in the long run. This is a systemic condition that some pregnant individuals develop after 20 weeks of the gestation period. It is thought that it could be caused by the placenta not developing as it should because there is a problem with the vessel supplying blood to it. Some people are more prone to this condition than others. For instance, those who have had conditions before pregnancy such as hypertension and kidney disease. Also, if the person has already had preeclampsia with previous pregnancies, they are at higher risk of developing the condition again. Higher weight and age, as well as ethnicity, are also factors. Carrying more than one fetus also presents a greater risk. One more important fact to note: people like myself, women who are like me, are at a much higher risk of severe preeclampsia, which includes preterm birth and infant growth restriction, with the rate being 60% higher than these women. Prevalence of the condition worldwide, up to 10% in all, up to 16.7 births in developing nations and 0.4% in developed nations. Unfortunately, mothers and or infants succumb from the condition when it develops into eclampsia. This presents as seizures, which are caused by swelling in the brain. And hypertension puts pressure on the blood vessels which cause this. If preeclampsia is not carefully managed, then this can be the end result, unfortunately. These statistics are up to 1.8% in developed nations, while as 15% in developing nations. To be more specific, the statistic in 2020 for maternal deaths from hypertensive disorder was just under 26%. There is also research into the paternal contribution to preeclampsia. There are certain genetic variants which may be deemed incompatible with the mother. In most cases, preeclampsia ends when the placenta is delivered in its entirety. However, there is also postpartum preeclampsia, which is rare but presents similarly as soon as the mother gives birth. By the way, don't forget to subscribe, comment, like, and hit that notification bell. While I was pregnant with my second child, it was suggested that I shouldn't have any more children because of the obvious risks. This wasn't a difficult decision for me to make. I realized that my body and chemical makeup did not handle pregnancy well. However, everyone is different. I was told what would be best for me, and you should be told what works best for you. If you haven't, please ask, advocate for your body and your health. I have monthly checkups with my doctor because, amongst other things, I need regular blood tests to check on my GFR and creatinine levels. I'm now on the cusp of 3B. I've done everything I could to curtail the process, but ultimately, my kidney function is heading that direction. There is also my blood pressure, which at its recent highest was hitting me with 160 something over 100 and something. It has been higher than that previously, by the way. Madness. My doctor has been switching up the medications at times. So with the monthly checkups, we've been taking the blood test to also check on whether these issues are moving in the positive direction with that or not. In the midst of it all, my doctor and I have been trying to figure out one thing. What is at the core of all of this? Tell me, right? Why on earth didn't I remember that I had preeclampsia? Then again, I don't remember a lot of things. As soon as I mentioned this, my doctor said, oh, protein, hypertension. This is when everything clicked. And where the serious information now comes into play. Listen, if you or anyone close to you are thinking of having children, I urge you to take all of this into consideration. Not everyone will present with preeclampsia, but there is the possibility that, especially if you are predisposed to having hypertension, you would be at higher risk. You may not have known of preeclampsia or eclampsia until now, but this condition was first mentioned by Hippocrates in 400 BC. He mentioned that a headache accompanied by heaviness and convulsions during pregnancy was bad. Of course, it was not labeled as eclampsia at that time. This came about in the 18th century when Boisse de Sauvage, I'm so sorry about that, but he was thought as the first person to use the term, which is from the Greek word meaning lightning, describing the sudden nature of the seizures. It was after this that other characteristics were associated with the condition, such as swelling, proteinuria, etc. However, it's only after the introduction of the ability to test blood pressure in 1896 then was preeclampsia labeled as a hypertensive disorder. More extensive studies have been carried out in the 20th century by Leon Chesley, who followed up on hundreds of preeclamptics for many years with special focus on renal function. As time has gone on, it has been found that post-preeclamptic patients will develop certain chronic illnesses affecting the brain, liver, kidneys, heart, and blood vessels. So it's not something that some of you may see immediately, but as time progresses, you will feel the results of it. So just to explain, in my research, I have discovered that post-preeclamptic patients can develop kidney disease, memory complications, neurological issues, liver issues, proteinuria, heart problems, hypertension, to name a few. Unfortunately, the following stats have been observed. Every 2 out of 3 women with preeclampsia will succumb to heart failure. Patients are 3 to 4 times at risk of developing hypertension, and the risk is doubled for heart disease, stroke, and diabetes. Other conditions can also manifest over time, such as mental health issues, PTSD, dementia, and reduced quality of life dependent on the severity of preeclampsia. It has also been proven that the lifespan of mothers who had recurrent episodes is 48.9 years versus 51.9 for a single episode. This is a very serious condition which needs to be taken into more consideration by those who are thinking of bearing children and those who have had either gestational hypertension or preeclampsia. Did you know any of these facts? Would you let others know? Subscribe, comment, like, share, and do all the things you know that you should do to pass the word along. And then there are the children. According to PubMed Central, they have 50 to 60% increased risk of endocrine, nutritional, and metabolic diseases. There are also potential issues with blood pressure, vascular function, and body mass. Children normally have a lower birth weight and may present with high blood pressure early on. However, there are ongoing later in life studies, and just as with preeclampsia in the mother, I think it would be wise to keep researching on your own and ask questions of your healthcare provider should you have any concerns. When I left my daughter on the way home, I started to cry. We had put 2 and 2 together and discovered that this is why I'm ill. Right after this, however, I did something that I'd like to make you aware of. It is so important to find the correct way to share this information with your loved ones, most especially with your children. For example, I tried dressing up things, keeping the information as lighthearted as I could.
Hello there, hi, because I want to share this video with people that matter to me. So, well, you know that I'm the type of person that has been having different things going on throughout the years, one thing or the other. Well, guess what? Today is your lucky day. I actually found out the why behind most of my ailments. Yay!
Of course, especially for adult children, that backfired. And if you are close to your children who would have unknowingly been a part of your journey, tell them. Talk with them about what the experience was like. Give them a chance to ask questions, feel sad, all the things. Preeclampsia is serious, so they, as well as you, need the chance to experience the emotions that come with realizing the impact of the condition. You may feel the need to grieve the outcome of preeclampsia concerning your later years, and it's okay to do so. If possible, do this with your kids. They will need comfort as much as you will. Talk with a counselor and or your doctor to have that extra support. All in all, be gentle, but be real. I worried that my kids would feel awful about playing a pivotal part of my condition. They didn't. In any case, if I knew that this would happen, I would still do it all over again. And I've let them know that. If you've reached so far, thank you so much for watching. Just stick any flower emojis in the comment section. Peace and blessings, and I'll see you in the next video.